So we get patients who are limited in range of motion. What do we do with them? Well, we got to stretch them. We got to find ways to increase that range of motion as long as it's not contraindicated and as long as there's not other issues going on. But in general, the other exception to that really is that tenodesis that we talked a little bit about last semester, where sometimes limited range of motion is a benefit to a patient. Okay? It allows them to hold their brush, or it allows them to hold a spoon, or it allows them to function in a way that they normally wouldn't be able to. In that situation, obviously, we wouldn't want to improve range of motion, but most of the time, you'll get a eval from the PT, and it'll be, this patient has limited range of motion in shoulder flexion and shoulder abduction, and it's your job to get them from 120 degrees of flexion to the full 180 or at least 160 or so where it's more functional. So, how do we do that? Alright, first of all, you got to prepare, okay? The first thing you do in preparation is you talk to the patient. You explain what you're going to be doing. Hey, I'm going to be stretching you. You explain this is probably going to be a little bit tight. It's going to hurt a little bit. Shouldn't be really painful, so to speak, but if you've ever stretched yourself when you're pretty tight, you definitely feel it, right? So you just want to make sure that you go through with the patient what you're about to do, why you're going to do it, the value of it, and what it's going to, how it's going to benefit them, and then get consent, okay? Make sure they agree, okay? All right. So the next thing you do is you have to choose the technique that's going to be most effective for that patient. There are different types of stretches. There's just plain, straight stretching, which is a lot of what this will go over. Next class we'll talk about PNF stretches. There are dynamic stretches. There is cyclic stretching, which we'll talk about a little bit today. But there's just all different kinds, and so you have to decide based on what that patient is going through, which stretch is going to be best. Okay? All right, so the best way, one of the best ways to prepare them is to warm up those tissues. Okay? You don't want to stretch cold tissues in general. I know that we did talk about spray and stretch technique with cold. It kind of provides a little bit of a block, but you're not really cooling the muscle itself. You're just doing a sensory, basically cooling, a surface cooling, to where they don't feel the stretch as much. But in general, if you make a muscle cold before you stretch it, you run a higher risk of a tear or a pull as you're stretching. So we don't want to do that. The best thing to do is to heat up prior to. Just going back a little bit, one of the things that Amy kind of commented on is why are you putting on a cold pack before doing range of motion? That's kind of more of a personal preference thing. If somebody's inflamed and they have limited range of motion and you're about to do some passive range of motion with them, I don't think personally there's anything wrong with icing it for a little bit to knock down that pain. Just make sure that what you're doing is passive range of motion though. You don't want to do active or stretching range of motion, okay? So that's maybe just a little bit of a difference of opinion on that, and that happens, with different therapists. So, anyway, so the best way to heat up ultrasound, most commonly it's ultrasound. Okay, turn it to one of those thermal settings. Find the little spot in the area. It depends on where it is. For a bicep, usually it's going to be if you've got a flexion contracture, and contractures are just named for whatever direction you're kind of stuck in. Okay, so if you're stuck in this, you're stuck in flexion. It's called a flexion contraction. Okay, so in that situation, the biceps is going to be tight, right? That's where the problem's going to be. And if you feel it, usually right down in this area is usually where it is. And you can literally feel it. It feels almost like there's rocks in there. And so, unfortunately, I don't think any of us have that. But you'll eventually find people and you'll work with them. You'll be like, wow, I know what he's talking about.
Does it tend to be near the attachment sites?
It tends to be. And it, for some reason, and I don't know exactly why, it usually tends to be distal. It usually tends to be at the insertion, not the origin, usually. There are exceptions to that rule, and every once in a while, I've worked with people who've had tight hamstrings that the knot actually was up more into the muscle, but most times, like with hamstrings, it's usually right here, just below the top knee, okay? So what you would do is, you would just take your ultrasound, put it on a thermal setting, apply it to that for 8 minutes, and you got about 10 minutes after you've heated it of more elasticity in that muscle, where you can get more stretching. So you can do a hot pack, you can use diathermy. There are even ways you can actually use even e-stim for it, but I've never done that.
If you were able to get a little bit more range of motion, will it stay there? If you get them to here, do they now have that much range of motion, or will it go back 10 minutes later?
It takes time. It takes a little. So it's not just like once you get that range of motion, they keep it. If they continue to use that extra range of motion, and this will come up here in a second, then it will stay. Okay, but if they don't use it, if they go back to their same habits, it'll just go away. And so it's one of the things you'll work with them post stretching, and that'll come up here in a little bit. But just know you can heat that up and it gets things ready. One other thing you can do is exercise them a little bit. Get that muscle moving, and it will heat it up in a similar way too. So if you can maybe put them on the bike a little bit before you stretch them, if you're going to do the legs, that can help a little bit too. The other thing you can do is just a little bit of joint distraction. Okay, since you are allowed to do lobes, I know that's not good, but okay, you can also do joint distraction. So the next thing you want to do is make sure you pick a comfortable position which allows correct stretching direction. So what's the right direction? Opposite of whatever the muscle does. Okay, so what do the hamstrings do? What? Flex the knee. So if I'm stretching hamstrings, I want to get Katie Camaro. Then I want to put the patient supine, prone, so that I can get access to going the opposite direction of whatever the main actions of that muscle are. So what are the actions of sternocleidomastoid? Flex the head, lateral flexion, and cervical rotation to what? Is it opposite or is it same? It is opposite. You're right. I'm just testing it out. It is opposite side. So if I wanted to stretch sternocleidomastoid, if its actions are flexion, lateral to the same side, and rotation to the opposite side, what actions do I do to stretch it? The exact opposite actions. Okay? So that's why I was like, you need to know the actions of your muscles, because if you want to know how to stretch a muscle, do the opposite of its actions in general. Okay? Hip flexors, they do other things, but mostly they flex. So how do you stretch them? Extend. Extend the hip. Okay? Your upper traps, okay? You got lateral side bending and you got extension. If you really want to put a good stretch on the upper traps, forward and to the side. Okay? The other thing about that is you want to make sure you're separating origin and insertion. So the other thing you can do, borrowing Katie again, is hold the insertion site down and then stretch. Okay? So make sure that I'm keeping them as far from each other as I can and increasing that distance on the muscle. So make sure you position them right. Make sure that it's free of restrictions, okay? You don't want to have them in tight clothing. That's fighting against you as you're doing it. So make sure they're wearing shorts, or make sure they're wearing some kind of loose fitting shirt. It's really hard to fight against clothes too. So just be aware of that. Just something to kind of keep in mind. Encourage the patient to relax. You don't want them fighting you. You don't want them resisting you. You want them to let you go as much as you can into that range of motion. The more they fight you, the more resistance there is, the more chance that a stretch becomes a pull, which we don't want. So get them to kind of relax, try and calm them down, move slowly into it at start. Don't go straight into, all right, let's, get there. Move into it slowly. Other things you can do is massage it for a little bit first to kind of relax it. Maybe put a little bit of BioFreeze or just lotion on it to kind of calm them down. You're still warming up the area, and it helps them get into that kind of relaxed state. All right. So now we're getting into actually doing it. So the first thing you want to do is, let me get Satchel here. Don't forget, I did not forget I owe you pizza. I will do that this semester. I didn't though. All right, so let's pretend that we're stretching. We'll do hamstring. So lay prone again for me. So lay prone for me. Okay. So let's say he's got a flexion contracture of the knee, and he can't get his leg past here. Okay. Now there are other ways to stretch, but if it's a normal person and I'm wanting to increase hamstring stretch, I might have them on their back, have the leg straight, right? Kind of like we showed you this morning. But we'll say he's been sitting in a wheelchair. He's an old grandpa. Hey, grandpa. That has been sitting in a wheelchair for too long, and so there's no way I'm going to get stretch on both joints, right? So I want to focus on one joint to start with, okay? So I'm going to try and get the knee first, and usually if it's a multiple joint, you want to start with the lower joint, okay? Since the hamstring crosses two joints, I can really stretch it at 2 points, is what I'm trying to say. But I want to pick the lower of the joints first, and if I get him to where he's straight here, okay, that doesn't mean he doesn't have tight hamstrings still, right? Because he may not have very much flexion of his thigh at all, of the hip, because the hamstring is still so tight, okay? But he's been sitting in a wheelchair before for a while, and he's stuck here. So I would get him, and I would just slowly move it to where he has range of motion first, okay? Get it to that point of extension. That's the first thing. Just kind of slowly get him as far as he is able to go first, okay? So hold it there for a second, all right? Until you can't move it anymore, okay? Go ahead and put it down for now. We'll come back and use this up.
So once you feel that like stop, that end build,
Yep.
just hold it.
Hold it there for a second. Kind of let them relax into it for a second. Then the next thing you do is, okay, place one hand above to stabilize the joint so that they don't fight you or lift up or resist, okay? If I'm trying to push here and he's lifting here, it's putting the hamstring on more of a slack to fight me, so I need to keep that still. So I put one hand here, put one hand here. Doesn't matter too much, just know the closer it is, the less resistance you have. The further up, the more power you have, okay? With somebody younger or somebody who's fairly fit and active, up here is probably fine. If you're somebody dealing with somebody older, they may not be able to handle that kind of pressure. So you might want to start a little bit closer and then slowly maybe move up as they get further. Does that make sense? Okay, one hand here, one proximal, one distal. Okay, then all you do is, and you don't want to squeeze. Use the flat of your hand. Okay, stabilize that body part, and then you just slowly, so kind of resist me a little bit, act like it, and just slowly start pushing. Make sure that the push is in the right direction though. Obviously I wouldn't be probably on my knee here, okay? For body mechanics sake, I would get a chair. And just kind of slowly push, okay? You want to try, and you're not trying to get an entire thing. You're not trying to get the whole thing in one stretch. If you get just a little bit more, that's plenty, okay? So you get them to that point, and then you push just a little bit past that point, and you hold it. Try and hold your hands flat, don't squeeze them, don't make it any harder. So, how long do you hold it? 30 seconds is, 30 to 60 is optimal, okay? And this I already went over, see, but, so if it's an over one joint, start with the lower joint, get full range in that lower joint, then move to the higher joint, okay? And we'll get into this one in a second. This is one of those PNF stretches. Think about the possibility of different types of stretch once you get to this point. Just know that. We'll get into those in a second. So apply it slowly with a constant amount of pressure. Don't bounce, okay? Don't reduce. Keep it in the same direction. Be very slow, very careful. Continue to push throughout the whole time. If you feel it start to relax, which sometimes you will, you'll get a stretch and you're like, okay, that's good. And then all of a sudden you're like, there's a little bit less resistance. Go ahead and just slowly take that extra distance that it's given you, okay? The muscle will start to relax. The stretch receptors will tell you that it's okay, and the stretch reflex will let go a little bit. Then you can stretch a little bit more. So just know that. Enough to increase tension, and this is where you kind of have to balance. Some patients can handle a little bit more if they're young, if they're fairly active, if they haven't been in this situation for very long, they can handle a little more pressure. If they are, yeah, hang out for just a second because I'm gonna get but if they're older, if they've been in bed for a long time, if just know that makes your muscles weaker, not just in strength like we talked about earlier today, but also those ligaments and tendons and things like that in the body are weaker too. So you might have to stretch even more slowly, even more carefully. Okay, so there's not any right amount of pressure. Also, once people get older, osteoporosis, okay, is a real possibility, and you don't want to break anybody's bones. Okay. When they're young, you can almost push on them so hard that you can't create enough force to really cause them any problems. As they get older, or as if they have other issues, like if they're on steroids, that can make muscles more lax and more apt to tear. So just kind of be aware of those kind of things. It's not that you can't stretch them, you can. You just have to go at it a little bit even more slowly than you might with somebody who's in better condition.
I have a question, concerning the pain of a stretch. So say you have a patient that had a torn face, and you're stretching the knee, and obviously it's gonna hurt. And
Gonna hurt.
And you're gonna explain that to them, it's gonna be uncomfortable. But what's that point where they're like, well, I'm a 6 out of 10, or where's it stop?
And that's the thing is you kind of have to just talk to them, and we know the feeling. We know the difference of that's a stretch, and it hurts a little bit, but there's nothing wrong, versus when it's starting to feel like, that feels like it's gonna hurt me, like it's gonna damage me. And so that's just what I've always explained to them, is if it gets to the point where it's either too much, or it feels like it's causing you harm, you let me know and we'll stop and we'll take a break for a second. And so there's no way you can tell externally, you just have to really rely on the patient to communicate with you. And so that's where that part comes in is important. And you tell them ahead of time, you say, look, this is gonna hurt some, and so it's not, but it shouldn't feel like it's harming you, like it's damaging you, or it shouldn't be so painful that you can't stand it. You know, and even with a knee though, that's a little bit tough, because there are times though, and you just have to kind of fight through it. You know, and so it is a tough balance. If you're getting range though, if you're getting a little bit of increase, you're getting increase, and so you just take it as best you can. And we'll talk in a little bit here, there are options that you can do in those situations. If they just can't tolerate 30 to 60 seconds, what you can do instead, okay? All right, so, let's make sure. Any pain patient feels should subside, and that's the other thing is after you do it, as soon as you finish the stretch, if they're like, oh, okay, no problem, you're fine. If you're stretching them enough and they pull it out and it hurts continuously after that, or for even minutes after that, you probably pushed a bit too much. You need to back off the next time. And they should never feel pain the next day, okay? If it's 24 hours later and you've stretched them and they're like, I'm sore from the stretch, you overstretched them and you've actually done a little bit of micro tearing, and you need to let them rest for a day. Let that heal, and the next time go at it a little less aggressively.
What about when we did the spray and stretch?
Mm-hmm. Well, and that's the thing is it's spray and stretch is still the same kind of deal though. The only problem with that is it's going to block the pain for a little bit. So you actually have to be a little bit careful when you've already killed that pain. Same thing if you heat it up with ultrasound or something first. Just know they may not be able to feel it quite as much, so just be a little cautious. You know, it's kind of a tough balance. I wish there was just like a right answer or a right amount of pressure, but really there isn't. It's kind of just playing it by ear, thinking about all the different dynamics of the patient, and kind of going, they're older, they're on medications, I'm going to go a little bit more slower, or this is a pretty young person, it's a new knee replacement, I know they're okay, we're going to really get after it. And so part of it is if you practice with real people, you'll start to kind of get a feel for it. Okay? Alright.
How long of a break would you suggest? Like, so say they did come back and they're like, I'm still sore from the stretch that we did. And so you give them like a day break or?
2 to 3 days. Okay? Because it's more like when you overdid it lifting and you're sore, it takes 2 or 3 days before that soreness goes away. It literally is because of micro tears in your muscle. You've actually technically done a bunch of small muscle tears to yourself. But what happens is the body rebuilds those tears better than they were before, and that's actually how you get more muscle strength and mass. So all of it is actually micro tears. When you stretch, you can actually do the same thing. You can cause those micro tears. You just don't want to. That's why they say if you're really sore, you don't work out with those muscles until you're not sore anymore, right? Right, take a day or 2 off, depending, maybe 3. Usually it's 2 to 3 days. Okay, that's also why they have you rotate upper and lower and things like that, so that those micro tears you build up have time to rebuild. There are some muscles that you can just keep working out.
Yeah, like abdominal.
Yeah, it's just because they're so big and so that it's really hard to do enough care to them to cause them.
And with that being said, so if they like, you tell them, okay, we're not gonna stretch it maybe for the next couple of days, just to give your muscles a little bit of a break. But you don't want them to lose what they've done, so do you say like maybe have some stretches on your own, or?
You just want, what you would want them to do, and we'll get there in here in just a second, is make sure that they're still trying to use the range of motion that you gained.
That you already have.
Yeah. So if you've gained, 2 degrees, say I want you to, extend it as far as you can and hold it. Don't necessarily push, don't try and go further, but I do want you to several times a day go as far as you can and hold it.
Okay.
So anyways, 30 to 60 seconds if the patient can tolerate it. Like I said, if the tension decreases, if you feel it start to let loose, Go ahead and take that extra within that 30 to 60 seconds. Once you hit 30 to 60 seconds, go ahead and stop, even if you've gotten some gains, because you don't want to over tear, over stretch. Because literally you are tearing those fibers. Okay? Anytime you're tight, it's because those muscle fibers in there have started to stick together. Okay? They've started to kind of bind together. That's what tightness is. As you stretch them, you're literally pulling those muscle fibers apart from each other. Okay? So you don't want to overdo it. So you don't want to do it for too long. 30 to 60 seconds is what they say is kind of optimal for a stretch. So once that time is over, slowly release the stretch. Okay? Don't just go from, okay, here we go, we got it, and boom, let go, or whatever. It wouldn't drop like that. Okay? They would want to actually come back. Okay? Kind of just slowly back it off a little bit and then let go, and then just let the patient rest. Okay? Usually, if you're stretching for 30 seconds, you want to let them rest for a minute or two. Okay? You stretch for 60 seconds, let them rest for 2 or 3 minutes. Kind of a 1 to 2, 1 to 3 kind of ratio there. Make sure that they're ready though. That they're like, I'm feeling good, it doesn't hurt anymore. With something like a knee replacement, where you're dealing with a surgical scar, it might take a little bit longer. You might need 3 or 4 minutes in between, because it's not just the muscle that's the problem, it's the scar itself. And so if they've got increased pain, wait until the pain subsides and they feel comfortable and ready. Okay. All right, go ahead, sir. All right. It also allows you to rest, okay? But don't be scared to take a break. So you can do that 3 to 5 times, okay? It just kind of depends on what the patient can handle, what you can tolerate, what you're going for. If it's somebody that you're kind of new to working with, you might just try 3 times to start with, kind of build up to 5 possibly. I don't know. The more you can do, the more they can tolerate, the better off they are. You don't want to do like 10 sets of it though. That's just too much. Okay. 5 was always kind of my wheelhouse. Like if I could get to 5, I was super happy. But some people are like, I can do 4, and then they're like, I need a break. So you kind of have to listen to the patient. You want to shoot for at least 3. There are exceptions to that rule though, and it's here. So if the patient can't tolerate 30 to 60 seconds, okay? If they're just like, I cannot do 30 seconds, it hurts too much, it's too tight. You can adjust it. Try 10 seconds or 15 seconds and work that. And I've got it here. If you do 30 seconds 5 times, that's 150 seconds total of stretch, right? They've done tests on people, and if you do 15 seconds at 10 times, 15 seconds of stretch, but you do it for 10 sets, you still get 150 seconds of stretch, and the results are the same or at least close to the same. Okay? That second kind is called cyclic stretching. Okay? It's where instead of going for the whole 30 seconds because you just can't get it, you go, okay, well let's do 10 then, but we'll do it 20 times. Okay, or 15 times, or whatever. Okay, you kind of get about the same. And so if you still get the same amount of overall time stretched, the effect is still the same. Now you don't want to do a 10-second stretch 3 times, because that's probably not gonna, that's only 30 seconds of stretch. That's not enough to really make a difference. Okay? If that's all they can handle, better than that than nothing, but you do want to definitely try and increase that from there on out.
What's that called again?
Cyclic stretching. In a cycle. So it's just smaller, it's not a one long sustained stretch. It's like 10 seconds, 10 seconds, 10 seconds, but you do it like 15, 20. So there are options, that's the point of the picture there. It's not like you can only do it the 30 to 60 second way. If they cannot go down one path, do it the other way.
how much time would you do in between there, like letting them get some rest and then, alright, let's go again?
You don't need to as quite as long, but it really kind of depends on patient tolerance with cyclic stretching too. But if you give them 30 seconds to a minute and they're good to go, you can go ahead and keep going. But you just want to make sure you do give them some time. All right. So another thing that you can do, and I'm going to have you lay down one more time, and then I'll pick somebody else, is as you're stretching, okay, if you find that knot, one thing you can do is massage that knot as you're stretching, okay? And we haven't talked about myofascial release. I don't even know if that's something we'll talk about in here. But it's that pressure, it's almost that trigger point that we've talked about. You find the muscle, you follow along the fiber of the muscle, you hit that bad point, and you just kind of press on it until it starts to release, okay? It's a massage way to start pushing those fibers apart and to break up some of the fluid that's gotten trapped in behind those fibers that have bound up. Cross massaging is you just go across the fibers, kind of like you're rubbing on a rope, kind of back and forth, and it helps break those fibers loose too. So one thing you can do as you're stretching them is just kind of really a pretty deep, aggressive type massage will sometimes kind of help those fibers start to loosen up as you stretch them as well. Okay? All right, you're done. I'll pick somebody up. Thank you,
But that
Satya.
also decreases, well, maybe not decreases pain, but kind of increases mind.
Well, it does a little bit. It provides a little bit of that gait control to where it doesn't hurt as much. And so there are some people that I've just kind of done some touch massage just because it helps people walk those pain receptors a little bit. Okay, so like I said, this is a slow process. You're not looking to get 10, 15 degrees in a day. You're looking to get 2, 3, maybe 5 degrees of extra range of motion in a day. Okay? If somebody's really tight or has a contracture, this can be a month's process. Okay? It's not going to happen overnight. So don't try and push too far. Don't try and go too far. Better to get slow gains than to overdo it and get too far. Baby steps. Okay? Yeah. Better to get 3 degrees range of motion in a week than to get 5 in a day and have them not be able to do anything for a week because you overstretch them too hard and then they come back and can't because they're too sore. And you don't want to risk an actual tear. And then in that week, you lose everything. Okay? So better to think of it as an incremental thing. You don't need a steak all in one bite. Cut it up into pieces. Okay? And same thing with stretching. Get that person to a little bit better than they were before, and then next time a little more, and then next time just a little bit more. Okay? This is where cold can come in. Once we're done with the stretch, applying cold after the stretch, get it into that range of motion that you've had it. Try and keep them to hold. We're not pushing for any extra, and then apply ice for a little while. It causes those fibers to kind of tighten up, and it helps maintain the range of motion that you've gained. Okay, does that make sense? So you increase it, get it to that extra knee extension, put some ice on it, let it rest there, and it helps those muscles kind of tighten back up, and it actually reduces the soreness that they might possibly feel as well. Okay. The other thing you need to do after stretching is in that new range of motion. So say my biceps, okay, was here. I got me to where I'm here. Okay. Try and get not only just movement, try and say, okay, I want you to move into that new range of motion. We're going to move and do some range of motion there, but also do some strengthening in that range of motion. Okay. So you might do some maybe isometric in that new, because you've got fibers that have not been worked that are now exposed. if you strengthen those fibers with some like isometrics or something, they will have a tendency not to lose that gain as quickly, okay? So think about range of motion and strengthening, or even using that new range of motion. An example is if a lady hasn't been able to brush her hair because she's only got this much flexion, and you get her to where she can touch the top of her head, have her afterwards try and just brush the parts of her hair that she can, because it's using that new range of motion. The more they use it, the less chance they'll lose it. Oops. How do I go back? Oh, I already said that. Strengthen that new range of motion. Add strength in that. Precautions: never stretch beyond normal range of motion. That is, if knee flexion is 150 degrees, or 160, 150, 150. Yeah. 150, right?
135.
Really?
No.
Oh, biceps 150, okay. 135, you don't want to try and go past that, or if hip flexion is whatever it is, you don't want to go past that, because what happens is if you go past the normal limits or normal range of motion, you actually create joint instability, okay, which increases risk of falls and things like that. So, just because I can get an elbow maybe possibly past 0 degrees, you actually don't want to. That's hypermobile. Hypermobility is not a good thing. It causes, increases risk of falls and joint damage and things like that. Okay, so don't. The other thing with that is as people get older, those ranges will decrease. Okay, so if 135 is it, if you get a patient to 120 and they're functional, 120 is probably okay. Okay, especially in an elderly person. Okay, you'd rather have tight joints a little bit than overly lax joints because of the problems that you have. Osteoporosis, all the things that I've talked about. Be careful with those people. Be extra cautious with them. I hit this one too. The further you are from the joint, the greater torque and force you're creating. So just be smart and think about that. It's not that you can't. Just know, though, the more torque you're creating, the more chance you have to damage the actual tissue, like damage it, not just those micro tears that we want. Especially in elderly people, you can literally snap a muscle, like loose, and then that's a big issue. Okay? So just be smart. Especially if you're older, I'd start a little bit closer, okay? And maybe apply a little bit less torque and pressure on it. Younger people, they can handle a little bit more.
You said work on that lower joint first, too, along with that when you're
Yes,
doing the hamstrings, and then go
Yeah.
to the.
Yeah, if it's so if it's a joint, like, for example, if they've got a flexion contracture in their hand, okay, and every single joint is here, and so we know that they've got, what muscles would be tight? The extensors would be actually long, right? The flexors would be shortened and tight, right? So flexor digitorum profundus, flexor digitorum longus, right? Those would be tight. So if I'm going to put a stretch on that, where should I start? In the finger. Yeah, in the finger. So I would first start trying to get the fingers, and if I get those to where they're pretty regular, then I would move to the upper, the MCP, the metacarpal phalangeal joints, and then move up into the wrist. Okay? And that's true for any of them. The hamstrings are tight. I'm going to work on getting the knee to where it goes flat first, and then start working on increasing hip flexion. Okay. So, like I already said this one too, any soreness should stop within 24 hours. If it doesn't, you're overstretching. Okay? If there's edema present, don't stretch. Okay? Same concept as range of motion. Okay, if there's swelling, you don't wanna do active range of motion. If there's swelling at all, you don't wanna do stretching. Okay, wait until that joint has had time to heal. If there's swelling, it's a sign that there's micro tears and fractures in there already, or maybe even bigger than that. You don't want to increase those, okay? You can take a joint that's been harmed and make it really, really bad. And that's it. Okay, so, let's see here. That's really most of stretching. The only other difference is there are some different types of stretches that we will actually go over next class. But let me real quick hit a few highlights, and here are the things that weren't on my slideshow. And I will make the PowerPoint available to you. But just real quick. So just the terminology that I want you to know, like as we talk about this, and then we'll go over the indications and precautions, most of which we've already covered, and then we'll practice a few stretches real quick, and we'll be done. Okay. So elasticity is the ability of soft tissue to return to its relaxed length after stretching. One of the problems is muscles are elastic. So the tendency is going to be for it to actually return to that old length. So that's why it's important to strengthen in a new range and to move in the new range and to have them on their own keep using that new range that they've gained. If they don't, it'll just go back to what it was and you're fighting kind of a losing battle a little bit. Viscoelasticity, it can change though, and that's the thing is we can take those muscles, and even though they are elastic, they also have the ability to become longer. And finally, plasticity means that if you get it to a point where it is consistently stretched beyond that, eventually it will stay in that increased range of motion. It won't necessarily go back. Okay. Contracture is just a softening that has become has been there so long that those fibrous tissues start to form either in the joint itself or in the muscles, and then it's a really, really long, hard process to tear all those fibers back loose. Hypermobility, we went over, that's not enough. It can be tightness or it can be a contracture. Hypermobility, that's where a joint goes further than it really should. That's not a good thing. We don't ever want to stretch into hypermobility. When should we stretch? Obviously when range of motion is limited. When they don't have enough motion, we want to stretch them. We want to increase that much. The other time you can do it is prior to exercise or activity. Sometimes stretching can kind of help warm things up and loosen things up a little. Okay. Precautions: don't stretch past normal range of motion. We always hit that. The one we didn't hit, and then the thing is if there's a fracture. Okay, but I talked about it earlier. Obviously, we don't want to stretch if there's a fracture because you're putting pressure on bones underneath. So if there's a present fracture, obviously not. But even if it's a recently healed fracture, you might want to wait a few weeks, let it get solid before you really start stretching. Think about age, immobilization, all those things that make those muscles and tendons weak. And if it's too long, if there's a bony block, don't do it. Obviously, I hit on that earlier. Fracture, don't do it. Inflammation, don't do it. We already hit that. If there's all of a sudden a real sharp pain that wasn't there before, that's a sign that there's been a pull or a tear. Stop. Don't continue. Let them assess. Give it a day or two. Report it honestly and say, man, I was stretching them and they said there was a sharp pain. Get the PT to look at it. Maybe get nursing if you're in a facility to look at it and report it. Okay? Don't try and hide it. It can happen. It doesn't mean you necessarily did anything wrong. Better to face up to it and deal with it If they're okay the next day, they're okay the next day. If not, you just give them time to heal and be a little more careful next time. If there's bruising, a hematoma, or other indication of tissue trauma, okay, if they got bruising in that area, or if they've had a fall recently, there might be trauma. You don't want to increase the trauma, okay? Stretching is a trauma to a muscle. You don't want to double up on that trauma. Obviously, hypermobility we've talked about. When the contracture is beneficial, either for tenodesis or it's a joint that it's keeping stable that wouldn't be normally, then you don't want to do it. And your PT would talk to you about that though, and so it's not like you're only stretching when there's a goal for stretching. Basically, when there's a goal to increase range of motion, your PT wouldn't ever order you to increase range of motion unless there was a time to do it. If you had a concern about that ever though, you were like, well, she uses that, and so I don't know if we should stretch her hand. Just talk to your PT and explain it. Okay, maybe they just didn't think about that or didn't understand. That's it. That's it. So, what I want you to do for the last 10 minutes, is practice a stretch, okay? So, we will have, let me just mix them up here. We'll do Megan and Brooke Hawkins. We will do Taylor and Denise. We will do Eric and Zapi. We will do Shalane and Crystal. We will do Valerie and Martina. We will do Brooke and Katie. We will do Jacob and Alex. We will do Ray, Dawn, and Caleb. And we will do Satchel and Maria. So what I want you to do is hamstrings, okay? Chances are everybody in here has full knee extension, so I want you on your back, and I want you to try and do a stretch into more flexion, okay? Because almost everybody has tight hamstrings. We just do because we don't really use them very often. So just try one round.